There's controversy swirling tonight over a new deal Google's made that will allow the tech giant to get its hands on the medical record of millions of Americans. The deal involves Ascension, a Catholic healthcare provider that wants to consolidate the data in one place on Google Cloud. The move raises a lot of questions. John Brehany of the National Catholic Bioethics Center joins us from Philadelphia with some answers. Thank you for being here, John.
It's a pleasure to be on. Thanks for having me.
Now, you're an ethics expert. What are the issues with this deal?
Well, I think it's important to point out that there are several. There are some legal issues that apply in different ways to Ascension and to Google. And apart from that, I think there are at least two ethical issues. One, how is information about people being protected or used? And a second is, how are people being treated? Are they being informed? Are they giving permission? So it's around issues like that that I think the ethical issues arise.
Now, neither patients nor doctors have been formally notified of the Google arrangement. Is that a problem?
Yeah, it does seem from news accounts that very few people knew. So not only was the public not informed, the patients weren't informed, even the doctors working in the system, it appears, were not informed. So that appears to be an issue. I just want to point out, and I think all of us have had this experience, you go to the doctor's office and they say, sign this, sign that. One of those forms you sign on probably every new time you go to a doctor is a form in which they summarize how they'll use your information. We all sign that and we don't think twice. But in a sense, I think everybody signed that. But did they really realize it?
Yeah, it's a scary thought. The feds have reportedly launched an investigation into the patient data deal. What could they be looking at?
Well, I think, there are complex questions. Like I said at the beginning, there are legal issues that would pertain to Ascension. And under the law HIPAA, a law from the 1990s that addresses health information, Ascension can share information about patients with business partners if it helps them to be a better healthcare organization. So that's the Ascension piece. Now, Google, the question is, what can they do with the information? Are there safeguards in place? Besides protecting it, we know that companies can use our information to profit, or they can use it to interact with us in new ways. And they're probably looking to see if anything improper has been done or proper safeguards are in place.
John, do you think those are dangers? And if so, what are some of the other biggest dangers that could come from this arrangement?
It's a good question. If the safeguards weren't in place, well, one example is maybe if these servers got hacked, and we hear about government websites being hacked, company databases being hacked, there's a sense in which they're collecting so much personal and very important health information. They seem to be storing it, in one place. So, yeah, more could go wrong if it got hacked somehow. There might be ways that people might want to profit from it.
And now, John, really quick, I just want to look at another side of this. Ascension wants to get all of its records together in one place. What would be the biggest benefit from that?
Well, I think one benefit is just having things in a safe, secure, and unified place. So there's definitely a benefit. And it's true, knowledge is power. Data is power. They can use this data and analyze it not only to help individual patients, the patient in question, but to help other patients as well. So there are some good reasons for this.
John Brehany of the National Catholic Bioethics Center, thank you so much for being with us today from Philadelphia.
You're welcome. It was a pleasure.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.